For almost 2 years, the dynamic clearing policy has kept China largely free of widespread infections and deaths and attracted attention worldwide. It is a policy that fits China's national conditions and it's based on scientific rules. China's all-around response to the pandemic has produced solid results because the authorities place the people's life and health front and center. Public health experts argue that if these measures were not taken in a country with the world's largest population and densely populated cities, the results would have been catastrophic. Shanghais, for example, China's financial hub and one of the most vibrant cities in the world, is fighting its biggest battle against the pandemic. But Shanghai's population is more than 25 million people, which is higher than the entire population of Australia, and is concentrated in just a little more than 6,000 square kilometers, which means the virus, especially this highly infectious Omicron variant, can spread at tremendous speed within the community. It is true, some countries did open their borders while taking measures to contain the virus, but that is not easy for a country as populous as China. For example, China's population density is 153 persons per square kilometer, while in Europe it is 34 persons per square kilometer. The threat for infections multiplies manifolds. The nature of the novel coronavirus is not fully known yet, and it is still mutating. But while China is fighting to contain the virus within its territory, there is another battle, perhaps a bigger one, to be fought, the global battle against misinformation and tendacious comments. Alarmist views can instigate only fear and prejudice among the people. Sadly, during this public health emergency in China, some attitudes, comments, and opinions from many parts of the world have been not fair. Bad-mouthing a country in normal times is bad enough, but fueling bias and animosity against the country in times of a health crisis is truly malevolent and malicious. First responders such as doctors, nurses, health workers, military personnel, delivery men or service providers, but also volunteers, those deserve to be saluted, for they are the real heroes ready to make this ultimate sacrifice for their country and their people. The mobilization of governmental and social forces and the implementation of comprehensive medical measures will eventually help China eradicate the threat. Resilience will prevail, as it always has in China.